Heaton. I'm with Love is Healing LLC. We are a trauma-informed care mental health practice, but we also really take into account holistic health while addressing the mental health component. And so today I just want to talk a little bit about physical health, right? Because the body is a whole system. It's not one individual thing. It's not just mental health is in a separate compartment and physical health is in a separate compartment and your liver is one certain thing and it doesn't impact your gut. No, everything impacts everything. And I just want to acknowledge that a lot of people have a trauma response where they fawn, right? And so it's hard to call things out as they are. It's hard to address conflict at times, and I just want to tell you, really just give you some words of encouragement that you are entitled to do that, right? Especially when it comes to your healthcare. For example, if you have a therapist that you're not satisfied with, if you don't like their approach, right? Or I don't know, you need to be seen more often or you need to be seen less often. It's within your rights to be able to advocate for yourself, and it's the therapist's ethical responsibility to listen to you, right? I've also heard that with medical, right, doctors, physical health, you can make requests, right? Or, okay, can you please test for this, or I need something alternative. I know that you're prescribing this medication. I need something alternative that doesn't impact my liver or something like that. You're welcome to ask those questions. It's their duty to be able to address your concerns. Also, I learned recently, by recently I mean within the past 6 months, that you can tell them to document, how does it go? Document that they dismiss the patient's concerns in their chart. So you could be like, okay, cool, hey, I'm interested in getting this blood test or whatever. And then they're like, no, da-da-da-da. Okay, great, thank you. Then if you're not willing to do that, please document it in the chart that you dismiss the patient's concerns. Stuff like that. In the coming months, it's so hard to find my voice. I know I say that all the time. But I think it's mostly because I know that my audience is very polar opposite in their views, and I really am trying to discern for myself the middle ground so that I can present it in a way where everyone kind of can gather value from it. Anyway, I know that a lot of atrocities have come up more into light, right? A lot of exploitation, especially by the medical health system. And so I'm going to do my best to equip you with things to be able to address that. Ways to help you advocate, and here soon I'm going to share my story as to what even led me down this path. But yeah, I hope that helps. If you have any specific questions, you can put them in the comments. You are empowered though. It's your body. You get to make decisions. It's your duty. It's your right to be able to have informed consent, right? What are you actually prescribing to me? Why are you prescribing this to me? Even with therapy, what are we doing? Why are we doing it? What's your approach? Are there other approaches? You can totally ask questions. And if they become defensive, if your practitioner, your therapist, whatever, if they become defensive, then that's a them issue. And they're the ones that are triggered, and they're the ones who have to be responsible for their feelings and for their ego. It's not your responsibility to caretake in that situation. And then you can go and you can discern, cool, should I find a different practitioner who will be more aligned with my views, who will actually listen to me? Because I can tell you, you absolutely have a right to do that. And I can tell you that a lot of them do get really triggered, right? But that's a them issue. That's not a you issue. All right. Stay well.